Hello, everyone, and welcome to NSG 824 Advanced Health Assessment. I'm Dr. Ricketta Clark, and I will be the instructor of record for this course. Let's dive in a little bit and just kind of talk about what will be expected in this course, some of the things that you all will be responsible for during the time you spend in this course. So this PowerPoint presentation will cover basically what is advanced health assessment, why is the course necessary for me, and the various components related to or that are embedded into this course. So let's start with the purpose of advanced health assessment. So the purpose of advanced health assessment is to teach students how to do a thorough examination for all human systems. So that's from head to toe, doing a detailed advanced practice assessment of all human systems. Also, in advanced health assessment, you learn, or part of the makeup of advanced health assessment is advanced diagnostic techniques. So again, your assessment will go from that of the bedside nurse, and throughout the course, you'll learn various examination techniques, normals and abnormals related to being an advanced practice provider. At the end of the course, students will be able to conduct a comprehensive health history, because that's part of health assessment as well as collecting history, and perform a physical exam, comprehensive physical exam, conduct a focused health history, and conduct a focused physical exam. Students will be able to distinguish between what is subjective data and what is objective data. Students in this course, despite learning this probably in undergrad, they struggle sometimes with the differences between subjective and objective data, and we will learn more about that in this course. The course will also help students learn how to develop differential diagnoses. I will promise you this: you will not be an expert in this when you leave this course, but this course will give you some practice as it relates to how to think critically to develop a list of differentials. And then lastly, document your findings in the subnote format. So why is this course necessary for me? A lot of students ask that, and I think it's a very valid question, based on concentration or prior experience. I think it's a valid question. So this course is a generalist course. So every concentration or every student that is seeking to advance their nursing education to that of the APRN are required to take an advanced health assessment course. It's part of the curriculum. It's part of what is necessary for graduation. It's kind of like if you're working with, I work with a bunch of gastroenterologists. So I work with fellows and residents who are aspiring to be gastroenterologists. And so the residents, they all take generalist courses before they move forward into gastroenterology. And so this is kind of like a baseline course where you're really learning, just perfecting what you've already learned in your RN education, your BSN education, but it's also to enhance and teach you skills that you will need, history collection skills, assessment skills, all of that, differential diagnosis skills that you will need as an advanced practice nurse. And then lastly, it's for credentialing purposes for our institution, for all of the concentrations within the College of Nursing, DNP concentrations, all of them require that students take an advanced health assessment course. So let's talk about the components of the course. This is very important because this is how you'll be graded in the course. So let's take a moment to review this. So students must pass all three of these components that's listed here in order to pass the course. If they're not successful on all three, they will not pass the course. So, number one is didactic. And didactic encompasses your weekly modules and that you see in posted in Blackboard, and all the modules should be open for you. If they're not, let me know. But they encompass didactic encompass your module quizzes, and these are the quizzes that you take every other week. They typically open on Mondays and go from Monday to Wednesday. Monday at 8 a.m. is when it opens, and it goes to Wednesday at 8 a.m. with a review on Thursday starting at 8 a.m. and it will last or remain open to 11:59 p.m. These quizzes will be held in Blackboard. They used to be in ExamSoft, but we will do them in Blackboard this semester. The second portion of how you're graded didactically is through the proficiency quizzes. So these quizzes are found in the Bates Online tool. They're not weekly. They not even every other week. They're kind of scattered throughout the semester. So be very mindful of these and make sure that you're looking at your course outline to know when these things are required. And then lastly, our SOAP notes. You will do 3 SOAP notes in this class, and again, they are through. You should refer to your course schedule to know when they're due. And let's talk about due dates as relates to this course, especially the didactic content. Due dates are as they are posted in the course. There are no exceptions. Whenever the assignment is due, whenever the quiz is due, whatever is due on that date. If you have extenuating circumstances, I would have to know about that prior to the due date. I can't know about that after something or after you've missed an assignment or anything like that. So I would have to know well before the due date before I could make any allowances or consider any allowances. So please be mindful of that. Let's talk about the on-campus events. So we have 4 listed here, and it's a 5th one that we just added, and I'm going to give you some information about that shortly. But we have the initial OSCE, and that's where you'll do a comprehensive head-to-toe examination. The final OSCE is a focused examination. Then we have Skills Day. Sensitive Exam Day. That's what SED stands for, and that's Sensitive Exam Day. And that is our on-campus event as well. It's an 8-hour day. And then the Skills Day is an 8-hour day as well. Let me jump back up to the Skills Day. The Sensitive Exam Day. Anesthesia students, they are not required. You guys are not required to do the sensitive exam day, and you're not required to document this as any of your clinical time. From what I understand, you all typically have an airway day with your anesthesia program, so that will kind of substitute for that day, but you don't document hours for your anesthesia or airway day. The initial OSCE and the final OSCE, usually we're on campus. Everybody's not on campus for the full length of time. We usually post a schedule, and when the schedule is posted for those days, you'll be made aware of that, that the schedule is posted, so you can see what time you're coming. I have no control of the schedule. CHIPS makes out the schedule. So once they give me the schedule, I then post it for you guys. So you'll see what time you're to come for the initial and final OSCE. And then Skills Day, everybody's required to come, including anesthesia students. And that's typically an 8-hour day as well. Lastly, one of the on-campus events is for those students who are recipients of the new grant. I don't have it here on this slide, but this is a new on-campus Health Equity Day that we have. This will also be pretty much an 8-hour day, and so please check your course schedules to see what day that is. But this is also on campus, and it's only for the new grant recipients. And so lastly, The third method of evaluation is, of course, are our virtual simulations and clinical rotation assignments. SH is shadow health, so you'll see your shadow health assignments. They're basically weekly in one way or the other. We have two shadow health products in this course. We have Shadow Health Digital Clinical Experience and Shadow Health Advanced Diagnostics. Derm for primary care, we will not be using. This is an old slide and I didn't take it out. I'm sorry. But yeah, derm for primary care, we will not be using this semester. So our virtual simulation clinical rotations will only be shadow health and your actual clinical rotations. For anesthesia students, you will go to the perioperative environment, and for our other students, you'll have clinical rotations set up in various clinics in the city of Memphis. If you are a student and you're wanting to do your clinical rotations outside of the Memphis area, I suggest that you make sure that Rachel George and myself are aware of this immediately, as soon as possible. And I typically set a date for when you all need to have all of your documentation in, and I will send that out in an email or a course announcement letting you know this.